Hi guys, Dr. Stanfield here today with you at Advanced Rehab Medical. Wanted to cover some things today about maybe some things that people don't think about, patients don't think about in regard to what causes back pain. We always want to know what the fix is, but we don't really understand or think much about the causes. One of the causes is just sitting at home, and what I mean by that is we all have big puffy couches, right? Recliners or things that lean back. And ideally, the spine's designed to be under gravitational neutrality, where the head is over the thorax over the pelvis, and the pelvis over the feet. When we start getting these slumped postures, it creates more stress on your neuromusculoskeletal systems, mainly your muscles, and the muscles have to work harder, so it makes you more inefficient. So a lot of the postures that I see, and we're all guilty of it to some degree, but a lot of the postures I see, especially in younger, teenagers and that age, a lot of times I'll see them slumping really big in their chairs and that type of thing. And we all have some degree of that, and that's kind of what I'm going to focus on. So when you sit in your chair at home to leisure to watch a movie or just read a book or relax, typically the chair is going to be really leaned back with a recliner, or even just an office chair. They're just not made to have you sit straight up like you should be. And then some people go to, as a result of that, your back starts hurting because of that abnormal posture, which affects the bottom of the spine. And so people will get some things, sometimes they'll get a lumbar support. Well, lumbar supports are okay. Unfortunately, if you put this behind your back in your lumbar area, then it's going to accentuate my upper body to be behind my pelvis, and that's not where it should be. It should be more upright, no more than about 5 to 10 degrees reclined. So that's going to accentuate it and make it worse. So what you can do, if you have a lumbar support, don't throw it away. You can take and turn it upside down, and raise where it should be is right at the base of your rib cage. So just about 3 or 4 inches up, and now I've got support to hold me more upright. And what you're going to experience when you try this, what you're going to experience is the chest is going to be almost lifted. It's going to help you digest your food better. Nobody's going to digest their food well like this. They're not going to breathe well, be able to get air in their lungs. So if you have one of these at home, you can use it. Just turn it over. Use the bigger part. You can see, I don't know if you can see how that's shaped, but the bigger part like that, and then put it behind your back. And again, the apex of the curve should be right up at the base of your ribs, not down in your lower spine or lumbar spine. So that works really well. Then we have these here that we use for what we call spinal molding, that works really well to reshape the spine essentially over time. And you can use these to sit in your chair. They sit pretty well right for most people, unless you've got a really long thorax, to help you sit more upright as well. And and it's a little firmer than these lumbar supports. I use this in my car quite a bit, and you'll notice when you lean back on that, it just has an uplifting effect to the chest cavity to promote better breathing and digestion, and so as well as obviously supporting your spine. So give that a try. If you have any questions, give us a call, and better health to you.